Alright class, today we're going to be talking about anxiety. More specifically, I'll be teaching you guys about generalized anxiety disorder and panic disorder. Now, to get things started, we're going to be talking about Cody, who had panic disorder. This is the story of how he had the worst panic attack of his life.
I decided to drive to another town to visit friends, about an hour and a half away, catch up and drink. I go to university and my doctor is only available during the semester, and this was mid-August. I had run out of my anti-anxiety meds probably about a month earlier. I was feeling okay. Didn't really need them, but just the thought of not being able to get to them left me feeling uneasy. I figured it would be fine though. On the drive over, I began to panic, but I calmed down enough to make it there without incident. I was much more at ease when I got there and had a fun evening. The next day I woke up pretty hungover, and as you may know, alcohol can agitate anxiety conditions. We went out for breakfast and I was fine, but later we went to a bar to watch a sports game on TV. About midway through, I felt like I needed some air, so I went outside. The heavy feeling on my chest wasn't going away, and I was starting to get that feeling of unreality and dizziness. Then it hit me that I was in a town I wasn't familiar with nowhere to go and no way to get meds to calm me down. I started randomly walking down the street, that feeling of wanting to grab a stranger and beg them for help creeping into my mind. I even thought about calling an ambulance just to get a sedative. Eventually I texted my friend saying my hangover was hitting me and that I was getting a migraine. I barely made the 20-minute car ride back to their house. I played it off like I was feeling nauseous, but really I felt trapped in that car, like I was about to go insane. I wanted to try to just head home, but they insisted I stay. I didn't sleep at all that night, and the next morning I hit the road first thing in the morning. I've dealt with anxiety for over 2 years now, and luckily that was by far the worst attack I've ever had. Glad nothing like that has ever repeated itself. Okay, that's the first story.
Alright. Generalized anxiety disorder. This mental condition occurs when someone worries or is anxious in an excessive amount. Having generalized anxiety disorder makes it really hard to stop worrying and stop being anxious. This may also make it hard to sleep, relax, or concentrate. Do you have panic attacks? If so, you may have panic disorder. Panic disorder is characterized by, yep, you guessed it, panic attacks. Now what exactly is a panic attack? Well, let's look at this quick video clip of a reporter having a panic attack on air.
The world's most commonly prescribed medications may be providing a big bonus. Researchers report people who take cholesterol-lowering drugs called statins for at least 5 years may also lower their risk for cancer. But it's too early to prescribe statins slowly for cancer production. At this point, I realize I'm helpless, so I bail right in the middle. That does it for news. We're going to go back now to Robin and Charlie.
All right, thanks very much. Dan Harris at the news desk with some of the headlines of the morning. Want to go to Tony Perkins now. He is...
Once the fear subsided, humiliation rushed in. I knew with rock-solid certainty that I had just had a panic attack on national television.
These days, if you have generalized anxiety disorder or panic disorder, there are many ways for you to get help. But up until 1980, the American Medical Association did not classify anxiety disorders as psychological disorders. Back then, they were recognized merely as stress, something developed by women. Back then, it would have been called something like stress, something developed by women, and it would have gone improperly treated or not treated at all. Shift in thinking about anxiety disorders as psychological disorders came when scientists found a link between panic attacks and blood flow in the brain. Back before then, any treatments might have been something along the lines of going to a spa in a freezing river while eating herbs and having leeches suck your blood. That sounds pretty bad, right? Well, it was, and it didn't help. Nowadays, though, there are many different ways to deal with panic disorder and generalized anxiety disorder. We'll talk about those later. In modern medicine, there are many ways to diagnose these disorders. According to DSM-IVTR, you have generalized anxiety disorder if you have 3 or more of the following symptoms, more often than not in the last 6 months. These include restlessness, fatigue, difficulty concentrating, irritability, muscle tension, or sleep disturbance. Children only need to have the presence of one of these symptoms to be diagnosed. Panic disorder is a little bit more complicated to diagnose. To be diagnosed with panic disorder, you need reoccurring unexpected panic attacks and at least one of the following. You need a persistent concern about having additional panic attacks, worrying about the implications of the attack and its consequences, or a significant change in behavior related to the panic attacks. The most important part of the diagnostic process is that other conditions must first be ruled out. Generalized anxiety disorder and panic disorder are both linked to more severe conditions such as agoraphobia, drug and alcohol abuse, and depression. The issue with both generalized anxiety disorder and panic disorder is that, as of now, the causes cannot necessarily be pinpointed. There has been some linkage to genetics, but not overwhelmingly so. Misfiring neurotransmitters might also play a role in causing these disorders. Stress, environmental factors, and personal experience may also play a role in developing anxiety disorders, but the truth of the matter is, we don't know for sure. Alright, well, if we don't know how exactly anxiety disorders come about, how can you know if you're at risk? Well, if you're a woman, you're already at a higher risk to develop both generalized anxiety disorder and panic disorder than males are. Women develop both of these at a rate of nearly twice that men's do. If you are young and adolescent, you're at a higher risk of developing panic disorder. Well, if you're older, 31 being the average age, you have a higher risk of developing generalized anxiety disorder. Additionally, Caucasians are more likely to develop anxiety disorders as a whole over other races. So far, we've only discussed the facts about generalized anxiety disorder and panic disorder. Next, we're going to take a look at what these disorders actually do to someone who has them. Brittany writes about what living with an anxiety disorder is like.
I don't remember a time when I wasn't nervous. I always had an understanding that I was different than other kids. My family labeled me as a drama queen or overly sensitive, and my best friend would call me a scaredy cat. I would throw temper tantrums every day before school because I was so overwhelmed by thoughts of answering a teacher's questions wrong. As a child, when my mother was a minute late coming home from work, I couldn't breathe. I knew she was dead. I was scared to answer the phone because I was so socially anxious. I also never voiced my fears because I just had a feeling that I was different and that it wasn't okay to be that way. I had my first panic attack at the age of 14. I just remember sitting in my bedroom and doing my homework and all of a sudden feeling like I couldn't breathe. My heart was racing, my hands were tingling, and I was convinced I was going to die. I've never had a heart attack, but I think that is what it would feel like. I was home alone at the time and I never told anyone what had happened. I didn't want to worry anyone, but I mostly kept it secret because I just didn't want to deal with the problem.
That sounds like a terrible way to live one's life. Luckily, there are ways to treat both generalized anxiety disorder and panic disorder, and they both have the same treatments. It seems that speaking with a trained professional can help a patient work through their anxiety. The psychotherapist can also aid the patient in developing skills that can be used to help lower stress and anxiety and worrying in their daily lives. Psychotherapy is recognized as the most effective way for treating both of these disorders. The use of antidepressants and anti-anxiety medications can be prescribed to help someone afflicted with an anxiety disorder. A few downsides of these medications, though, are that there are several severe side effects that can potentially occur, and they also take several weeks to start helping. These medications are best used when used in conjunction with psychotherapy because they do not necessarily treat the causes of these disorders, only the symptoms. Each of these treatments has a different level of effectiveness for each individual person. Michael Timmerman talks about how he struggled with panic disorder and how it was hard for him to find a treatment that worked for him.
Growing up, I knew I was different. I lived with my mother and brother. My parents were divorced. My father had left and he never came back. It wasn't the easiest of circumstances, especially for a 6-year-old. As I later discovered, the abandonment triggered my anxiety attacks. I feared being alone, unwanted, unpopular, and unloved. Throughout my childhood, I was no stranger to the doctor's office. My mother tried everything she could in hopes of a breakthrough. I was on multiple medications, some habit-forming, but they only made me feel like a zombie. Years of seeing a therapist and talking about my anxiety and depression did little to address the heart of the problem. There were times I thought suicide may be the only way to make the pain stop. Then, one Sunday morning, my wake-up call came from a Parade magazine article. You know, the one that comes with the newspaper? Freddie Prinze Jr. was on the cover. The article detailed the pain of losing his father at a young age. He, too, felt unhappy and alone as a child. I felt as though I were reading my own life story. The only difference? He was now a success. That article inspired me to explore a new treatment option for myself. I wanted to turn my life around as well, so I hit the library and internet to research cognitive behavioral therapy, also called CBT. I began to realize how my negative thoughts controlled my physical well-being. Shortly after beginning CBT, I was able to discontinue medication and stop seeing a therapist. I never returned to high school, but I did go to college. After graduation, I pursued a career in television news. I began at a local affiliate in a small city. Several years later, I worked my way up to a major cable news network.
The most important thing to take away from Michael's words is that there's always an end to any psychological pain. There always gets better. Michael realized that if he could just change the way that he thought, he could pick himself up. It took years of trying dozens of different solutions, but in the end, he was able to turn himself around by using cognitive behavioral therapy. The important thing to take away from this presentation is that worrying a little bit is perfectly normal. Anxiety conditions are... The important thing to take away from this presentation is that worrying a little bit is perfectly normal. Anxiety conditions are characterized by their long-term nature and their repeated attacks. It is recommended that you talk to your doctor if your anxiety is overwhelming you, interfering with your work, preventing you from having normal social interactions, or if you have substance abuse or depression. I want to thank you for all watching this video and hope that you all learned a little bit about generalized anxiety disorder and panic disorders, how they come about, how they can be treated, and all sorts of different things about these two terrible psychological disorders. Have a great day. Bye.